All right, welcome everyone. We are here with Alpaca Health CEO, Michael Gao, and we're going to talk about just the step by step. We need to get organized, get our feet on the ground, and start walking. We're not going to be running yet, but we want to at least start walking and moving towards our strategic objectives. So, Michael, welcome. Thank you for your time.
Well, thank you guys for having me. It's been great to be in the Facebook group community for a couple weeks now and commenting in places, oftentimes just lurking, but seeing some of the awesome conversations that y'all help facilitate. So hopefully I can help teach you guys some things, add some value. If you do have questions, feel free to reach out or put it in the chat. Today's webinar really focused on how a clinician who has not set up their LLC yet, hasn't started on anything in the process yet, maybe hasn't even done the course, the ABA Impact course, how you can start thinking about setting up your practice. I want to go over the step-by-step blueprint, step-by-step guide about how you can do that, tips that we've learned along the way. But maybe just start with a little bit of an introduction. My name is Michael. I'm one of the founders of Alpaca Health, where our mission is to help clinicians, BCBAs, become clinician business owners. My background before this, I actually built a small education company focused on one-on-one mentoring and tutoring. We actually work with a number of special needs kids. I started the company fresh out of school and really fell in love with building something from nothing, really fell in love with not just being an entrepreneur, but working with families, working with parents, working with children. I'm sure a lot of you relate to that. My family is a long line of entrepreneurs. My dad ran a small IT consulting company. My grandfather ran like a little bodega corner shop in China. And so I think for myself and also my co-founder Bao, we both really strongly identify with people wanting ownership over their careers, over their financial futures, over their lives. And that's what we want to try to bring to ABA, helping BCBAs become business owners. In the education world, we worked with a number of kids with special needs and had the chance to collaborate with a few BCBAs. And it just struck me how many big ABA companies existed in the ABA world. In education and tutoring, there are very few big tutoring companies. It's normally just like a tutor independently practicing with a couple of families, and that's how they make ends meet. But in ABA, it just felt like there's less private practice ownership, less entrepreneurship than there really should be. And so at Alpaca, our mission is to help BCBAs become business owners. To take a step back, I think I personally just believe that local small businesses with owners empowered to serve their own communities is just like a net good for the world. If you put ABA and the world of healthcare aside, it's bad that Walmarts are replacing independent groceries, that mom and pop restaurants are being replaced by McDonald's. And I think to come back to ABA, it's especially true here, right? We see how when big ABA companies scale across states, across the countries, care sometimes becomes less individualized. There's these cookie cutter templates. There's minimum hour requirements, even though a child might not need them. We know that care is so relationship based in ABA, but now at a big company with many staff members, families are getting swapped between BCBAs and BTs regularly. And so I just having had the privilege of partnering with BCBAs over the past year, talking to parents, talking to families, I just believe so strongly that we need more clinician business owners. And what that means for us is clinicians owning their finances, their times, and their clinical judgment. We know the work of healthcare is done by BCBAs and BTs, but what you get reimbursed from insurance, it's siphoned away by inefficiency and bureaucracy. We think clinicians should take home what they earn, period. We think you should own your time. If you get a master's degree, there's a lot of great work you do and clients who need your work. And so we need to help clinicians spend less time on paperwork and more on patient care. And we think that clinicians should own their clinical judgment. And if you decide a kid needs 5 hours a week, we'll support that. even if it is below some hypothetical minimum hours requirement. And so at Alpaca, what we do is we provide best-in-class modern technology. We do admin services for you, and we also guarantee payouts every 2 weeks. Happy to get more into this after today's webinar, answer questions about it at the end. But I just wanted to give you some context about where I was coming from and how we help practices get off the ground. But today, I want it to be less about what Alpaca does and more about what we've learned about starting ABA practices so that you could do it yourself with us or even without us. So today, I'm going to go over at least 5 different buckets here. Each of them, I think, are really important in starting your practice. First is going to be starting an LLC, thinking about getting a legal entity set up, EIN, liability insurance, some of the foundational basics you need to have a business. I'll go over contracting and credentialing, how you can get in-network access to payers in your state. I'll also talk about alternative models. Insurance payment isn't the only way that you can build a business. I'll talk about marketing, how you can get your first client and your first technician, if that is the clinical model you choose to go. I'll talk about what intake looks like in an insurance-funded service, some of those administrative things that you want to think about when delivering insurance-funded services. And then I'll talk about what matters, what we don't like talking about, but what really matters is how you get paid and then how you can pay your staff. Before I get into this, I will just start by saying that having worked with about 24 BCBAs now, everybody starts this process incredibly afraid about starting a business, incredibly nervous about all the different administrative back office things that business ownership entails. And what is also true is that 2 weeks down the road, 4 weeks down the road, when they get their first client, most of the BCBAs we work with say, oh, wow, that really wasn't that hard. And so I know it might seem daunting now, but having worked with a number of BCBAs, it really isn't as hard. You already have a master's degree or higher, you've already done significant training. That stuff was the hard part, not business ownership. So to get into the first step, starting an LLC and getting legally incorporated. So a couple of steps here. The first is you want to start some sort of entity. Typically, it is an LLC. You could practice as a sole proprietor, but there are risks to that. It's harder to hire technicians and other staff members. And so I think to set up a good foundation for yourself, you want to incorporate an LLC. To do this, you'll need to file articles of incorporation with your state Secretary of State. Every state has a slightly different policy about how to do this. In Texas, it's super easy. You just get an LLC set up. In Delaware, you have to get a business license and use that license to get your LLC. So every state is slightly different. There are a number of services that help with this step of just filling out paperwork, mailing it out, processing it for you. There's a company called Bizee, B-I-Z-E-E, that we recommend to help with this step. They don't charge anything on top of filing fees. And so it's actually quite cheap to incorporate an LLC. It's like $300, $400 tops, depending on the state. If you choose to go with an outside vendor like Bizee to start your LLC, you just want to make sure you don't get upsold. They're going to try to sell you marketing services, sell you website design. Don't do those things. Just incorporate the LLC, and then you're off to the races. Once you have your LLC with the state, you then need to tell the IRS that you exist so that you can get your EIN. If you think about how you use your social security number for employment, for job applications, that's what the EIN is to your LLC. And so you'll need to register your LLC with the IRS to get this EIN. A lot of those business incorporation services like a Bizee will also help with EIN procurement. It costs a little bit more. It's not that hard, but it's also not that much more typically. And so I recommend folks just start their LLC and an EIN with the same vendor if you choose to do that. Once you have your LLC, you can now get liability insurance. Now, you've probably, if you've been working for other companies, gotten your liability insurance from your company, from the company that you currently work for. If you're starting your own practice and you're doing so while you're employed for someone else, you should get your own liability insurance, because your other company's liability insurance does not cover you when you deliver services outside of that company. You also want to get your own liability insurance so that you can roster other staff, technicians, BCBAs under that liability insurance so that it's easier to grow in the long run. If you're a 1099 contractor, you probably already have liability insurance. You just want to make sure that liability insurance is not just covering you, it's covering your LLC. We typically refer out to CPH Insurance. It's a pretty easy to use liability insurance provider and very much focused on small independent practitioners. You'll need a business bank account, and you'll need to start thinking about finances. We typically recommend, even from day one, practitioners separate out their personal spending from their business spending. It's just easier down the road for taxes and things like that. There's a number of great business banking solutions out there, from your traditional bank to new tech startups called Novo. Pick whatever feels best for you. And as you're going about this process of setting up your LLC, you're probably paying filing fees. You might be paying for outside vendors. You're paying for liability insurance. Keep track of all that, because all of that will be deductible. And basically everything from here on out you spend on your business will help you save on taxes. So start writing those down from day one. From here, you'll need to go through a contracting and credentialing process if you want to deliver insurance-funded services. Now, there's a lot of alternatives to insurance-funded services. You could deliver private pay services. You could partner with a school to deliver school-based services. And even if you do want to help people with insurance, you can always act as an out-of-network provider, super bill the patient, give the patient a bill. The patient pays you first, and then the patient and the family goes to their own insurance company to get reimbursed for services. Now, that model typically only works when you're working with families with some amount of disposable income, so it's not available to everybody. Insurance-funded services is the most traditional pathway, and it's the pathway that gives you that best probability of getting clients from day one. I do want to spend today focused on what the insurance-based model would look like, but I just want to call that out. There are other options to building a business outside of insurance. If you do choose to work with insurance, there's two main processes to start. There's a contracting process and a credentialing process. Folks get these two confused. They say credentialing when they mean contracting. They say contracting when they mean credentialing. And they're actually two distinct processes. Contracting is when you sign an agreement with payers that sets your rates with those payers. Typically, if you've worked for someone else, your company has already done that for you. And so when you join, you just have to credential yourself under the company's contract. You've probably already done that credentialing step. And so you might say, oh, I'm good to go. I can accept insurance. I did it at my last company. That's not true, because you have not gotten yourself or your LLC contracted with payers. The payers have not agreed on a rate that they're going to pay you. And so you just want to be really aware that even if you have delivered insurance-funded services before, you have to go through a new contracting process, and then also following that, a credentialing process. The credentialing process might go a little bit smoother if you've been in network with that payer before, but it still exists as two separate processes. Now, you probably will deal with Medicaid as a new ABA owner. Medicaid contracting and credentialing is even more tricky. It depends on the state, but in many states, especially larger ones like a Texas, there are different levels of Medicaid, and you have to get through the boss Medicaid, the state Medicaid, to get to some of the local Medicaid, MCOs. And so to use Texas as an example here, if you want to go in network with Texas, you first have to go to the state, go through a contracting process, and then a credentialing process. That lets you see families who have what's called traditional Medicaid. A majority of clients, depending on the state, may not have traditional Medicaid. They may be assigned what's called a managed care organization. So basically, Medicaid delegates that client's healthcare to a private health insurance company. And so if you're in a state where the majority of patients in Medicaid are covered by an MCO, most of them are like this these days, then you'll need to go through separate contracting and credentialing processes with the regional MCOs. You have to first get your state Medicaid done, then you can get to the MCOs. So it has turned a two-step process into a four-step process with dependencies along the way. That's why Medicaid can take a really long time to push through. There are a lot of vendors to help you with this process. But if you wanted to do it yourself, this is the step-by-step process. The first thing you want to do is try to understand what payers you need to get in network with. Almost certainly Medicaid is going to be on your radar, but then what are the commercial insurers in your area? What are the top players in terms of market share in your state? This information is publicly accessible. We've created for the customers that we work with a spreadsheet that just says your state, top 5 payers. And we typically recommend focus your payer enrollment on the top 3 payers to begin with, then the next 5, then maybe branch out from there. Typically, insurance marketplaces are pretty concentrated. So if you get a network with Blue Cross Blue Shield and let's say Aetna, you'll cover most of your patient population. Before starting with contracting, credentialing, reaching out to payers, you want to get your ducks in a row. You want to get all of your documentation in one Google Drive, in one folder, in one OneDrive drive, because what you don't want is for an insurance company to ask for something and it takes you 3 weeks to find it. It looks a little unprofessional, but it also delays the process. Everybody says contracting and credentialing takes a long time, and it really does. But sometimes that's because you as a provider don't have your documents in an order before beginning the process. And that's why I recommend everybody, before they do anything, get core documents. And that's your NPI, it's your CAQH ID, username and password. You may not have access to this username and password if you've only worked for companies before. So you may actually need to go to the HR department, to the credentialing department of your last company and get this information. You'll need an up-to-date resume. You'll need a certificate of insurance, reliability insurance provider. You'll need your license from the BCBA, and also if you have state licensure, also your state licensure. You'll want to get your transcript and diploma just in case they ask for it. And then you will likely also need a CPR or basic life support certificate, especially for a payer like TRICARE, and also for various state Medicaids. It's a really long list. You do not want to be hunting these down while payers are on the phone with you. You want it all in one place. From there, every payer, annoyingly, has a slightly different process for payer contracting and credentialing. This is a theme that you'll see throughout the presentation is it's typically like this, but it depends on the payer. And that is certainly true of contracting. Some payers, you need to call them for them to email you an application. Others have a PDF on their website. Others, you have to email or submit a web form to get the application. Others already have the application on a payer-specific portal or on Availity, which is a multi-payer provider portal. It just depends. Every insurance company is different, and you have to sleuth around their website, call in to try to figure out how you can get the form. Once you get the form, you'll need to fill it out, attach the necessary documentation. More is always better here. You can never go wrong with attaching additional information. You can always go wrong by attaching less information. You'll put that together. You'll mail or fax that in. I have had to snail mail applications. New York Medicaid, you have to snail mail it. So be prepared to do some really old school things to get payers your documentation. Once you've submitted it, you want to follow up. Payers lose things all the time. I worked with a practice in New York that submitted payer applications in December, called in March, and then the department said, I never received your application. That happens more often than we like to think. And so you want to follow up regularly. Once you submit the application, you want to call a couple of days later to confirm receipt. Do not stop calling until they've said, yes, I've gotten your application and here's your application tracking number. From there, I recommend following up on the phone with payers at least once every 2 weeks. We do it once a week. And for some payers, we even do it every day if we know there's a long wait list of clients that are waiting. You want to follow up because payers will often have additional requirements, will often be blocked on something, and you won't know until you reach out. Sometimes if a payer has an online portal, it's not giving you the full information. So I highly recommend just call. A couple other things to think about. When you're doing contracting, there's a lot of dependencies. One thing depends on the other thing. Sometimes credentialing will depend on contracting will depend on credentialing. In Medicaid, your state Medicaid is a dependency before you can start with MCO enrollment. And then with commercial insurers, sometimes there's these carve-outs. This is what Carelon is to Blue Cross Blue Shield and Anthem in many states, where if you go through Blue Cross Blue Shield, they're going to punt your application to Carelon. Carelon will get back to you, and then you get sent back to Blue Cross Blue Shield to do the final enrollment and credentialing steps. Incredibly confusing, but hopefully this gives you at least a starting point to get started with some contracting and credentialing. While you are getting your contracting through, I always recommend folks start with client marketing. A lot of people say, what's the point? Contracts are going to take me at least a month. If I get a client now, I can't do anything. Why do it? And I recommend you do these things on parallel paths, because you don't want to be in a situation where you have your contracts and you have no clients. The ideal situation is you do some contracting, you do some marketing, and then together, once you have your first client, you have your first contract, and then you're off to the races. So how do you do marketing? The easiest answer is just use your network. I always, when I talk to BCBAs, ask the question, do you know who your first client and your first BT will be? And the first answer is always no. And then I ask, what about people you've worked with previously? Or, hey, you went to school in this area. What about other folks at UNT? That always has BCBAs coming up with names, people to text, people to follow up with, SLPs that you've collaborated with in the past who might have clients to refer to you. Your network is much stronger and much wider than you may previously have thought about. You just have to be creative with who you're reaching out to. I've had people fill up entire caseloads just through networking. They don't have a website. They don't do any steps 2 through 5 here. They just text their friends and they build a caseload that way. Now, if you aren't like that, there's still really easy ways to get clients. The next step is probably just to make some basic marketing collateral, a logo, a website, Facebook page, Instagram page, physical flyer that you can use to hand out. You can get really creative with this. I recommend people do not overthink this step. You do not need the best website in the world. You do not need the most beautiful Apple-like graphic design to get clients. You just need something to share. Something is better than nothing. You don't want to spend a lot of money at this point, right? Like you don't have money coming in, you don't have clients yet. So don't go out and hire someone. Just use the tools out there like Canva, like Squarespace, especially with new AI tools. All of this stuff that used to be very hard is so much more possible. There's a website builder we recommend called Durable that uses AI to generate your website. So creating this basic marketing collateral, it's so much more doable it is today than it was previously. Build it out, and now you have marketing materials to start using. So put your name on Psychology Today and link it to your website. Start going out there and just searching in your area. Who are the OTs? Who are the SLPs? Who are your autism evaluators? And go in person. Give them donuts, give them coffees, and hand them flyers. That's the best way you can start building these relationships is don't hide behind an email or a phone call. Just pound the pavement, go talk to people, shake some hands, and you're going to get your first couple of clients. When you talk to referral partners, you want to leave a fax number. This is just how pediatricians, autism evaluators, how they send referrals out. They get a fax, and they send it to the fax. So when you build relationships with referral partners, you want to give them some way of getting in touch with you. The last step that we recommend is using digital communities. You're already in a Facebook group, so you know the power and the reach of a lot of these Facebook groups. It turns out that there are so many different autism Facebook groups: autism moms, autism dads, autism support group, autism family member, ABA therapy, special education, special needs. There's so many of these Facebook groups, and there's usually a lot of these Facebook groups for your local area too. You can be incredibly surprised. We worked with a practice in Fort Hood, Texas, like not a huge town, right? Quite small. When we searched up Fort Hood autism, 3 different Facebook groups came up, about 100 members each. They posted there, got their first client in a couple of days. You would be surprised how many of these small localized communities exist for you to tap into. Now, when you go into one of these groups, you don't want to come in just selling and marketing. You want to try to add value initially. You want to be a little bit subtle about it. So when you get into one of these groups, try posting, here's some fun facts about what ABA therapy is. Because anybody who responds to that or asks you follow-up questions and comments probably is looking for ABA therapy. You can market without being sleazy, without selling. You can market by providing information to families. You also want to build relationships with the mods. Usually the people who are moderating or building out these Facebook groups, they just have really great connections. They can help promote you in a way that you couldn't do yourself. And so you want to reach out one-on-one to these moderators to see if there's other ways or other recommendations they have for you as you're building up your first caseload. I think you are in, as a BCBA, the best position to do this because you come off more authentic, right? You're not a business owner trying to build a multinational, multi-state company. You're just someone trying to help families and seeing what families need help. And so I think you are in the best position to go out there and find clients for yourself versus a big agency that is going to come off a lot less authentic. So now you have your first client. What's next? You probably need some staff. Now, again, caveat, this is if you do a traditional 3-tier insurance funded line. You could absolutely do BCBA direct services in an insurance funded world. You could absolutely do BCBA direct services in a private pay world. BTs are not required to start your practice. Now, there's obviously reasons why the 2-3-tier model exists. And a lot of the problems that we see with the 2-3-tier model with behavior technicians at larger companies are solved at a smaller scale. One of the reasons why you might avoid having BTs is you say turnover is really high, it's hard to hire them, it's hard to keep them, and the quality of technicians is just not that high. I want to deliver high quality services. That probably is the case at a big multi-state company that's just churning BTs in to pair with families. That's probably true because their standards are a little bit lower. They just want a body to fill the seat. And because it's a really big company, the BT joins that is a little bit detached. There's not like a single person who's their mentor. They just join and hope for the best. They don't have a relationship to the company, and that's why they turn over. As a BCB owned and operated practice, or even just like a small agency, you have a lot more ability to build a relationship with a BT, to really train them, to be more selective, to hire people who aren't just looking for a job, but are looking for a career in ABA. And you are in the best position to help those BTs succeed because you can provide supervision hours, mentor them on the way to getting their BCBA certification. You can help them get their RBT license, help them apply to master's programs. You actually can invest personally in staff members' careers. And so I actually think that small practices, new practices, have the best opportunity in capturing the most dedicated BTs who are in the field for the field, not just for a job, not just for a paycheck. And just from a numerical perspective, the average turnover, the average retention rate at our practices that we work with, clinician owned and operated, quite small, 80%. Find me a big company that can beat that number. That is what clinicians like you can cultivate. Now, how do you go about finding your first BT? Again, your network. It is so many of the practices that we partner with, they found their first BT because they just texted someone they were leaving their current company, and that person texted someone else, and it turns out someone else is looking for a job. If you're a BCBA and you're at a company that's like not doing really great, bad culture, your BTs are looking up to you basically as a supervisor. And so we've seen many cases where the BCBA leaves, the BTs want to leave with them. Now, you want to be careful here. You don't want to actively solicit. You don't want to push. You just want to announce, I'm leaving to a new company. And then if BTs follow up and find your website on Facebook or Google and decide to join you, that's not solicitation. That's just you having a better offering and a better workplace than whatever previous company you're at. Leverage your network and don't afraid to get creative. Use online directories. Everybody is using Indeed and LinkedIn. And the big companies, they're spending hundreds of thousands of dollars every single day on these platforms. And so you want to think about the places that are too small for the big companies, the places where it just does not make sense for a big company that needs 1,000 new BTs in the next 3 months to try to target. And some ideas there are Craigslist, your local Craigslist jobs board. There's actually still a lot of people posting jobs and looking for jobs there. Reddit, small communities, right? There's a Reddit community for your town. There's a Reddit community for behavior technicians. Post there that you're looking for help. And then local Facebook groups. There are so many local ABA groups, local BCBA groups, just local job classified groups that you can post in. Prioritize these unique, differentiated, small niche places over Indeed and LinkedIn. Indeed and LinkedIn are going to cost you a lot of money. You're competing against a bunch of the big guys. There's all these other channels that are basically untapped right now that you can leverage in a way that a big company just doesn't. The other idea that we've partnered with clinicians to try is having them reach out to what I call career connectors. Community colleges have career departments, high schools have guidance counselors, college and career counselors. ABA universities that have ABA programs have practicum supervisors, internship supervisors. All of these people, their whole job is to help people find entry-level behavior technician roles. And so you just want to tap into these resources. Say you're a new company, you're really interested in mentorship, supervising the next generation of BCBAs, and that's how you can get your first couple of technicians. And then the last idea is reaching out to your local workforce development organization. These are local offshoots of your state Department of Labor. Sometimes your county or city will set up one of these. But basically, these are these nonprofit organizations where their sole mandate is helping businesses find job seekers and helping job seekers find jobs. And so you want to tap into them because they usually have a pretty big resume bank. Again, this is the stuff that big companies don't do because they don't know your area, your region as well as you do. And they don't have as much authenticity reaching out to these local organizations and nonprofits as you do. Use your network, use your resources, and lean in on the fact that you're small, you're local, and you know your community. Okay, from here, you have your first client, you have your first staff member. What do you need to do? This is the stuff that your company probably did for you, but it's really important in an insurance-funded service for you to do. You always want to verify benefits. You never want to see someone who says they have insurance but actually don't. It's not intentional. Sometimes insurance lapse. Sometimes you're in network with the other branch of this insurance company, but not the one they have. It's very nuanced. So get their insurance card and get on the phone with insurance to verify that they are eligible for ABA services. Always talk on the phone. Don't use Availity because Availity often doesn't capture the nuances of ABA. You want to get on the phone with a rep and get a reference number. Once you get that verification of benefits, you'll on the call be able to get their deductible, out-of-pocket mocks, co-insurance, copay. You want to share these things with your families because a pretty big chunk of your pay is going to come from patient responsibility. And you want to make sure families know what they're getting themselves into. So you want to put together a document that says, here's how much you can expect to pay if you do start with services. If that looks good, you'll then go and get a prior authorization. You'll need to get approval typically for a 97151 to do the assessment. Once you've done your treatment plan, get your 5.3 and your 5.5 codes. Every payer has a slightly different way of doing prior authorizations. Some do it via fax, some do it via email, some do it via phone, some do it via Availity. So it's a payer-specific thing, but you do want to make sure you get your authorization approved before you deliver services. What does a patient responsibility document look like? I'll just show you the one that we use at Alpaca with our practices. You want to share with the family your deductible, your out-of-pocket max. But then you also want to explain to a family what the hell these things mean. And so this is how we do it. We've instead of just like defining terms, we've set it up from how much you need to pay. So first family, you need to pay enough to hit your deductible. Once you hit your deductible, then insurance will start pitching in a little bit. Not everything. You still have co-insurance, you still have copay, but now insurance will start paying for some of the services until you hit your out-of-pocket max, in which case you're set. And so what does that mean? You're going to be, if you get 20 hours of services a week, you'll probably have to pay this amount every day and every week. You want to step-by-step walk out for a family how much they're going to be paying you. We produce this document for practices Alpaca work with so that everybody's on the same page about services. You deliver services. Now you need to submit claims. This is your standard CMS claim form. It's called a CMS 1500 that software can do for you, or you might have to fill out manually. You might have to upload this to a payer portal, to snail mail, bunch of nuances around how to do billing and claim scrubbing. A couple of bullet points here. I'm not going to get into it for time's sake, but obviously you need to bill insurance. Now, this is the slide I want to spend some time, which is insurance is going to take a while to pay you, but you have to pay your staff every 2 weeks. So you want to think about that in terms of how much cash in the bank you have at the very beginning. So just to illustrate this as an example, if you serve someone on April 1st and you submit your claim that Friday, April 5th, you're probably going to have to pay your BTs that next Friday, April 11th. But insurers are going to take their sweet time to approve the claim. If it takes them 2 weeks, they're going to approve the claim on the 15th of April. But that doesn't mean the money is in your bank. The insurance company just said yes to the claim. It takes them at least another week for them to have the money go to your bank. Or if you haven't set up an EFT transfer, you're still doing paper checks, it might take another 2 to 3 weeks for the check to arrive at your location. And then obviously you have to go cash it, and that takes time too. And the biggest challenge, honestly, with starting your own practice is thinking about how you make this cash flow equation work. If it takes insurance to 8 weeks to pay you, how are you going to pay your staff every 2 weeks in the middle? Once you're at scale and you have a lot of payer revenue streams and you have a bunch of money sitting in the bank, this matters less. But when you're starting out, this can be a big problem that you need to try to solve. So I know that was a lot, and I hope it wasn't too scary for you, because I want to encourage everybody here to go and start their own practice. I think we need more clinician business owners. But I want to take some time here just to walk through what Alpaca does to help with starting your own practice, and then get into a little bit of question and answer. So at Alpaca, we provide all-in-one technology and managed admin services. So data collection, scheduling, billing modules, we have in-house. We built our system from the ground up. We have an AI compliance agent that generates session notes, that looks through your treatment plans to ensure compliance, that makes sure scheduling isn't going over authorization hours, all the things that you would previously have to hire an admin team to do, we do. And then intake, verification of benefits, patient responsibility collection, prior authorizations, billing, dealing with claim denials, submitting claims, credentialing, contracting, running payroll, all those services we do for practices we work with. We solve the cash flow problem by having practices join the Alpaca network. And so how that works is we have group contracts with various payers across the country. We credential you and staff that you have join your practice under our contract. When you deliver services, every 2 weeks, we will pay you 70 to 80% of the insurance reimbursable amount. That solves your cash flow problem because you'll always have enough to run payroll. We send you the money first, then you can pay your BTs. And so now Alpaca is kind of in a hole, right? We've sent you 70% of what insurance is going to pay. We only get paid once insurance reimburses us 6 to 8 weeks later. We get paid last year. You get paid first, then your BTs get paid. Then finally, barring any denials, disputes, audits, clawbacks, Alpaca gets paid. That's our model of partnering with ABA practices that are just starting up. And so that solves your cash flow equation because the revenue will arrive from Alpaca to your practice before you have to pay your BTs. That's the Alpaca Health model, an all-in-one platform to help you launch your practice. And hopefully, eventually, because many different BCBAs have joined our network, we can then go to insurance companies and payers and say, hey, we have a huge network of BCBAs. You have to pay us more now so that we can help you get paid for the work that you do. More practices means higher rates, means hopefully more practices can form to deliver higher quality care. That is our mission. That is our vision for the future. And it starts with helping BCBAs like you start your own practices. So I know that was a lot. I will pause here, open the floor to questions, but I will also leave my email here and then also a QR code to our website. So if that you're interested in talking further, exploring partnering with Alpaca Health, you can check out our website and book some time on my calendar.
Awesome. Yeah, and I definitely agree with the strength in numbers approach. Like we have to be unified here. And the more of us that gather, that's really what one of the big things that the ABA Business Challenges group is about, where because your numbers grow, you actually have the influence where you can pick up the phone and get the BHCOE CEO on the phone. You can actually make the needle move in these areas that need to change in a lot of ways. So I love what you said about the fear factor, right? Like this is not rocket science. You got your master's degree. It is far more difficult to go through the BCBA program and get your certificate for that than it is to start a business. But there's certain building blocks that you need. And it's important to remember that the laws of physics apply to everyone. It doesn't matter if you're the king or prince of a country or just a regular Joe. Like gravity is gravity. And it's the same for ABA and business principles. And I know our mission is important. Our struggles are a little bit different from what many other industries have, but it's still business. Inputs, outputs, and you need to know what you're getting into before you get too far into it, so you can be mentally and emotionally prepared to deal with the things you're going to need to deal with and deal with them up front instead of doing things that are going to be problems later on. So the process that you guys use, like what is your actual, how would you describe your actual business model at Alpaca? What's your, like, how are you generating revenue on your end?
Yeah. So when we partner with practices, we first pay practices out every 2 weeks. Then we will get reimbursed from insurance and then make our money on the backside.
Okay.
So when we work with the practice, we'll sign an agreement that says, hey, insurance is paying us $100 an hour. We're going to pay you $80 an hour for services rendered. We'll pay you that 80. And then when insurance pays us, we make 100, which makes up for the 80 that we've already sent you. And then also the 20 on top. And so why do we do this? Why do we just hand out money to practices? It's because we think that as a scaled entity that's working with practices of many states and many different payers, we're better able to solve this cash flow problem. We're able to get lower denial rates. We have a scale to pick up the phone and call a payer and say, why is this being denied? And even if there's denial, we can take the hit because we have revenue coming in from different payers in different states. If you're one practice working with 3 payers and all of them delay your payments for 6 to 8 weeks, it's game over for your practice.
So would you consider yourself a franchise? Is that, or
everybody who partners with Alpaca has their own name, has their own brand. Alpaca's only on the backside. And so I wouldn't say we're a franchise. The way I've called it is we're a practice in a box to help BCBAs launch, start, and grow their practices.
So you're providing the network for payment, like kind of the finance back end.
Yep.
But you mentioned compliance agent. Are you helping them with their HIPAA high-tech compliance on that end, or is that the business owner's area? And are you sectioning off the finance side and just taking that on? I know you're doing practice management as well, right? That's your whole thing. So from practice management to the billing is all done. We don't have to worry about that.
Yep.
And we're 20%, is that right?
Yep.
Okay.
20 to 30%.
And for anybody who's listening to this, when you go through the foundation course, we go through the calculations on overhead. And I was on the phone last week with a lady who has been a BCBA for a long time. And Josh was actually on this call too. And I said, why are you starting an ABA company? And she says, I know the company that I'm working with is getting, I think it was $95 an hour, and they're only paying me $50 an hour. If I'm doing the work, I want to get the whole 95. So let's talk about this for a second, because you're going to be dealing with 30% overhead, at least getting started. You might be able to bring that down over time. Plus, you're going to have fixed monthly costs per RBT. You're going to have, and all these things start to add up where that $55 or $45 an hour even starts looking pretty good, as opposed to running a smaller business. And I always encourage people, like, plan to scale above $1 million. Plan your business to get over that $1 million mark, because that's where you can really support a good income for yourself that's above what you would be making at another job. But she was just thinking about it from a standpoint of, I'm just going to have a couple RBTs working for me, 3 or 5. But when you start putting the numbers together, it doesn't work that way necessarily. You might figure out that you need 17 RBTs to make the kind of money you want to make. But the 20% number is actually surprisingly low, considering all the cash flow issues that are being taken care of, the practice management that's done, the billing that's done. And I love the fact that they have their own names and their own business. So you're getting like all the good stuff about the franchise model without all the garbage that comes with it. 20% is not much for what you're getting with that.
Totally. And hopefully, like with this model, you can't stay at $1 million in revenue or less, right? It can be you and 3 BTs, because like right now in our current setup, you have to scale the business to get some economies of scale. But with Alpaca, we give you the economies of scale from day one. So you can stay as small as you want because we have the economies of scale. I think it's interesting to see how this model evolves, but I think our thesis is right now these big companies do things inefficiently. Alpaca can do things more efficiently and give the benefits of those efficiencies to small new practice owners.
Yeah, and I love the model. And everybody has their different tastes and their different personal goals and their business goals. And you have to figure all that stuff out. And that's what our free course is all about. So take advantage of that. But the idea behind your model is you can stay small, and there's a bunch of things that you're checking off the list right out of the box. So I really like that whole setup. So how do you guys do the credentialing side of it?
Yeah, so we are contracting and credentialing. We do it in-house to make sure it's accurate. We follow up with most payers every 2 weeks, if not every week/more. We have a BCBA who has 12 clients on the wait list for Husky in Connecticut, and we're calling them every single day to push that forward. And so we think there's a lot of benefits by doing it in-house versus giving it off to someone else.
Yeah, for sure. I love it. All right. Looks like that's all the questions. Let's see. Scroll down and make sure. Oh, what will determine a 30% fee? I'm not sure what that means. Ira.
So I think it's just on the slides. I said Alpaca will take between 70 and 80%. Will pay you 70 to 80% of the insurance reimbursable amount. It just depends on the state and the market. There are some markets where we have pretty good maturity in payer networks from day one. There are other markets where we'll have to set up just like you are. Like we don't have our contracts yet. And so you have to wait a little longer. And so that's just what determines the fees.
Yeah. And then Amy's question about the paying mileage reimbursement. I think the mileage reimbursement thing is good, but it's not always perceived by people as being as big of a benefit as it actually is. And just a quick note, your RBTs that are coming into work for you, I'm assuming you're doing in-home for mileage, but if you're dealing with mileage situations, you're sometimes better off to show a higher rate of pay.
Yep.
And then not having to mess with mileage logs, because that higher rate of pay shows a higher dollar amount. And just us humans, we want that visible, like immediate, how much am I getting paid mentality. I think it's better on the RBT recruiting side to pay a slightly higher hourly rate than mileage, just to have a better flow. Awesome.
Agreed.
Michael, thank you so much for your time.
Yeah, this was a lot of fun. Thanks for having me. It was good to meet everybody.
Awesome. Make sure you check out for the free course and reach out to us if you have any questions. Reach out to Michael. Thanks, everybody. Have a great day.
Thank you guys. Bye.